Alrighty, this is Group C's presentation on CBD and stroke. Some stroke facts. So according to the CDC, more than 795,000 people have a stroke in America yearly, which is very high as it is one of the leading causes of death in America. And in 2017, Tennessee was ranked fifth in stroke as the cause of death, which is kind of scary. According to the America's Health Rankings, in 2019, it was ranked 50th, which is the worst out of all in percentage of adults who reported being told that they had had a stroke. So since we are currently in Hamilton County for school, I thought it was important to look up what the public health of stroke ratings were in our county and community. And we found this nifty little graph about stroke death rate per 100,000 between 2016 and 2018 in Hamilton County. And as you see, it's still really high among all races and ethnicities, but Blacks have the highest death rate in our county, and then a white non-Hispanic, and then Hispanics, which I think is pretty interesting. But being in the South, this doesn't necessarily surprise me. So, looking further at health determinants and disparities, in Tennessee alone, the rate of deaths related to stroke is 44.8 per 100,000 people, and that's higher than the national average, which is 37.4. So, this is important for us because we can actually advocate, educate, and work with our patients to help them understand the risk factors of stroke so that we can create a change in our society to help possibly decrease that rate. And then it's also important because as there are continuing people getting strokes, it's important for us that we are helping them rehab. So knowing this information is really good to have. And then when you're looking, like I said in the previous slide, at Hamilton County, the race ethnicity group with the highest deaths was Blacks, and then whites was the next. So this is really important to think about with stroke. Like I was saying, we'll work with patients every day that have been affected by stroke, or family members that have had a stroke, or even people who are working towards preventing the possibility of stroke. And since it's a non-communicable disease, there's a huge possibility of making a change in our society with this. So we kind of thought of some potential issues and health outcomes, and we think that mental health is a really huge issue that's affected. If you had a stroke and then you have to take on this financial burden because you can't work as much, that can add to your psychological stress, and then you could start developing depressive symptoms or anxiety. So that's a factor that plays a role. And then we also were thinking of having a lack of independence creates even more of a problem. And then you think of those families that are helping support the stroke victim, and there's a caregiver burden. And we know that can be difficult for families to be able to support that person. And then there's less community contributions. They're not able to get out and go into the society and do their job, and maybe even their social aspects are affected. And then you also have increased healthcare costs, which is a really important thing to think about because that can become a huge burden in society. Now, moving on to risk factors for stroke, I think this is important to recognize because we're working in healthcare, and I think that that's a responsibility of healthcare workers is to provide the best education for our patients, even if it's not directly, they came in for a total knee or something. It might not directly be affecting them right now, but we have the potential to change healthcare as a whole if we're helping educate our patients. So, some controllable risk factors that we could educate our patients about are high blood pressure, physical inactivity, and smoking. So, all of these can increase your risk of stroke, and they are definitely could be hard for a patient to change since, human behavior is difficult. But I think that with our encouragement and help, we have the ability to help affect this. And so, as a physical therapist, I think it's important that we, again, educate the patient on, eating the right foods, being physically active, and then taking steps towards smoking cessation. So, we already talked about the controllable risk factors, and I wanted to bring up the uncontrollable ones because this is important if you're already susceptible because of the uncontrollable risk factors to a stroke, and then it's even more important that you think about the controllable ones, um, so that you can decrease your risk even more, because, like, for example, your age has an effect on your risk of having a stroke, the family history, and your race or ethnicity, like we talked about before. Educating those patients that are at high risk for a stroke is especially important. um, Even if you have a patient coming in with high blood pressure, they're overweight, they smoke, you want to educate that patient that this is a serious risk factors, and stroke is not an easy thing to recover from, and we want you to be aware of what you can do to change this to help reduce that risk. All right, so finally coming to how can physical therapists help with public health. And I think that, as we are given the opportunity to work in healthcare, we are kind of signing on to be advocates for people and help educate people. And especially in Hamilton County, where this is a problem higher than the national average, we can help educate patients on risk factors for stroke and explain to them which ones can be modified, like I kind of said in the previous slide. And then we can help encourage and coordinate a patient to begin or continue regular physical activity. This one is super important because, we're the movement experts, and we can help educate patients and encourage them in a safe way, especially, if the patient has never been very physically active. We can say, you know what, I understand that you've never done this before, and we have the tools to help you. So we're going to help educate them or get them plugged into a community outlet that would help the patient to stay engaged in a socially active way as well, like getting plugged into the YMCA or something, or a walking program, anything that helps the patient to adhere more to being physically active on a regular basis. And then another way, especially in the public health arena, we can help educate the public in general through community outreach, and we could focus on stroke prevention and awareness. And since we are in a population that does seem to have a lot of strokes, we could, educate on like the FAST acronym, the face, arm, speech, time, recognizing when they are going developing a stroke, this could be really paramount to the patient so that they can get to the emergency department in time and have less sequelae from their stroke. If they can offer like TPA faster or something. And, this could also decrease the healthcare burden if your patients and the community are more educated on prevention and awareness. But, this takes a lot of work. And I think that we as physical therapists have the opportunity and the platform to be able to speak out to the community and help get others more involved in reducing this leading cause of death in America.